This video teaches viewers how to administer continuous compression or hands-only CPR and how to use an AED. In the event that an adult suffers from a cardiac emergency, continuous compression CPR can save their life. Please note that traditional CPR should be used on infants, children, and drowning victims. If you see an adult that you suspect is suffering from a cardiac emergency, follow these steps. Scan the area for danger and ask any bystanders for information as to what happened and when. Check the victim for consciousness by shaking and shouting at the victim. Note that unlike traditional CPR, those performing hands-only CPR do not check for the victim's pulse. If the victim does not respond, ask bystanders to call 911 and retrieve the nearest AED if applicable. Or, if you are alone, call 911 yourself and retrieve an AED if it is nearby and easily accessible. Then begin CPR or cardiopulmonary resuscitation immediately. Position yourself on your knees to the side of the victim facing their chest. Place the heel of your hand in the middle of the victim's chest between the nipples. Place the heel of the other hand on top. Lace your fingers together, straighten your arms, and use your full body weight to begin compressions of at least 2 inches at a rate of 100 beats per minute. Allow the chest to fully recoil in between compressions. Continue until one of the following happens. A, someone has arrived with an AED, or B, another person knowledgeable in CPR assists in the 2 rescuer CPR, or C, emergency personnel arrive. If someone arrives with an AED or automated external defibrillator, use the following procedure. Remove any clothing from the victim's chest and wipe the bare chest dry. Turn on the AED and follow the spoken prompts. Place the pads on the victim's upper right and lower left chest, as indicated by the AED diagram. There should be a diagonal line formed by the electrodes that pass through the person's heart.
E. Apply pads to patient's bare chest. Plug in pads connected to next to flashing light.
The AED will analyze the person's heart rhythm. Be sure all rescuers are standing clear of the victim. Follow the instructions of the AED. If no shock is advised, resume CPR as indicated by the AED.
Analyzing heart rhythm. Do not touch the patient. No shock advised. Begin CPR. Reanalyzing heart rhythm.
If a shock is advised, again give the verbal command to stand clear of the victim. Be sure to remove any nearby oxygen tanks or other fire hazards. Then press the shock button on the AED as it instructs. Resume CPR as indicated by the AED.
Reanalyzing heart rhythm. Shock advised. Charging. Stand clear of the patient. Deliver shock now. Press the shock delivery button. Beep. Pause. Begin CPR.
Continue CPR until the AED reanalyzes the victim, usually about every 2 minutes. Repeat the AED processes above until emergency personnel arrive or until the victim shows obvious signs of life such as steady breathing. Remember that occasional gasps or short sporadic breaths are not the same as steady breathing, and if these occur, you should continue to administer CPR as though the victim is not breathing. Using this procedure can allow you to save the life of an adult that experiences a cardiac emergency.